In this video, I'm going to show you how to give full back pain relief in 30 seconds. Stay tuned. Hey everyone, Dr. Rowe coming to you from SpineCare in St. Joseph, Michigan. In this video, I'm going to go over 4 really easy exercises that can give full back pain relief. All of these exercises work just a little bit differently. They're going to target different spots in the back, different muscles. To get the best results, go through all of them and use what works the best for you. As a bonus, all of the exercises can be done at home. They require no equipment and may give quick full back pain relief even within 30 seconds. So let's get started and fix that full back pain right now. So if you're looking for an exercise that's going to target pretty much upper back, middle back, lower back into the hips and groin, this is an exercise you'll definitely want to check out. What I'm going to do is start off on all fours, and you can do this one in bed or on a floor. I call this one the Scorpion Child. I'm going to blend 2 popular yoga poses, the Scorpion and the Child's Pose, together to take it to the next level. So let's take our feet, put them together just like this, and then slowly try to drive our knees outward as much as we can until you feel a very good stretch into the inner part of the leg going into the groin and the hips. I'm then going to stretch my arms out in front of me like this, take my fingers, grip into the floor of the bed as much as I can, tuck your chin towards your chest. From here, we're going to do a rocking motion, taking our butt backwards like this, our whole body backwards. The more that you go back, the more that you're going to start to feel a very deep stretch in the upper back going down to the lower back into the hips and pelvis. To intensify the stretch, take your fingers and crawl forward just a little bit more. This feels really, really good. What I like to do is hold this one comfortably for 20 to 30 seconds. Just do nice, slow, controlled breathing also. If you want to show your upper back a little bit of more love, what you can do is take one arm off like this and do what is called threading the needle. So I'm just going to put my arm flat on the floor or the bed and then slide and rotate my upper back as much as I can in the opposite direction. Really focus on moving through the shoulder blades. It feels really, really good. You can hold this one right here for 20 seconds, relax, and then repeat it on the other side. You can also put a little bit of more rotation into the upper back by pretty much getting back into our rocking position, but taking one hand, putting it on the back side of your head, and then winging your elbow upward towards the ceiling as much as you can. It just hits the upper back a little bit differently. Actually, I feel that one going all the way down into my lower back also. But give that one a try. Hold it for about 20 seconds. From here, I'd like to build into what is called the Scorpion Pose. So what I'm going to do is go flat on my stomach just like this. And then I'm going to prop my upper body onto my forearms. They're roughly in a V shape. I just clasp my hands together. I'm then going to bend my knees at 90 degrees, put my feet and legs together. What I'm going to do is keep pretty much my back from my waist all the way up to my chest flat, and then slowly move through my waist, taking my legs in one direction, kind of like a twisting motion. This right here will put a deep stretch into the pelvis and the lower back, and sometimes you might get a sudden pop, crack, or release into the lower back if it is locked up, but don't try to force it, only go towards a comfortable stretch. You want to hold this one right here for 20 seconds. You're just going to relax, and then you're going to repeat it on the other side. But go through all of those motions. I try to do that whole complete cycle for about 3 to 5 times, and with each repetition, I just try to build into it just a little bit more. With this exercise, I want to focus on a commonly overlooked cause of lower back pain, which are tight hip flexors, notably the psoas muscle. If you have a lot of pain in the front part of the leg that goes through the pelvis into the lower back, definitely check this one out. It's called the Psoas Cobra. We're going to start lying on our stomach next to a wall or a door. You're going to bend your knees at 90 degrees, put your feet right up against that door. We're going to prop our upper body onto our forearms just like this. Mine are in a V shape. I like to put my hands together. We're going to start with the easier version of the Psoas Cobra. This is called a press up. So in this position right here, and you can control the amount of stretch by lowering or raising your upper body, you should start to feel a very gentle stretch into the back, pretty much throughout the whole back, into the core muscles, and more importantly, into the front part of the leg, hitting those hip flexors. What you want to do also is make sure not to lift up on your hips like this, but to keep them flat during this exercise to maintain that stretch into the hip flexors. Hold this one comfortably for 20 to 30 seconds. When you need a breather, just go down like this. But I try to do this for 3 to 5 repetitions. And with each repetition, try to build into it a little bit more by pressing up. If you find that this is a little bit too easy, you can go into the full Cobra. So instead, I'm going to put my hands off to my side, roughly right around the shoulders, and then I'm going to press up just like this. This will really intensify that stretch, so only to your comfort level. Again, 20 to 30 second holds for 3 to 5 repetitions. You can also take this one to the next level by, instead of going straight with it, angle your body off to one side. This is especially good for hitting one-sided back pain. So let's say I have a lot going on my left side. Whatever side that you have it on, tilt your body in the opposite direction. So I'm going a little bit off to my right, and then I'm going to repeat this. You'll notice it hits it a little bit more on that left side. So give that a try. Go straight with it, go off to one side, and if any of those positions offer you more relief, throw more repetitions in. With this exercise, we're going to focus on getting rid of full back pain using just a doorway. This one is perfect to do at work if you have a free moment. So I'm going to go over 3 different movements. Each movement will target different muscles. The first one, I'm going to go right next to a door frame. I'm going to cross my arms over with my thumbs pointed downwards, and I'm going to grip into the door frame roughly around chest level. I'm then going to put my toes flush against that door frame. Tuck your chin slightly towards your chest. The movement from here is very easy. We're just going to lower our body away and down from that door frame. When you do this, you're going to feel a deep stretch forming in the upper back going down to the lower back. I actually feel it into my glutes and also into the back of my leg, the hamstrings. It usually feels really, really good. But just let your body go down and let gravity do all of the hard work. Hold this one comfortably for 20 to 30 seconds. When you need a breather, just come back up like this. I try to repeat this one 3 to 5 times, and with each repetition, try to build into it just a little bit more. You can also experiment with different placements of your hands to hit the muscles in the back just a little bit differently. So put your hands more towards head level and then give that a try. You'll notice that the back opens up just a little bit differently. So you can go all the way towards the top, go all the way towards the bottom. If one certain position gives you more relief, at that point, throw more repetitions in. I know that I have very wide doorways here in the office, so if you do feel your bottom right here hit the other side of the door frame, what you can do is just angle your body out slightly, and you should have no problem doing this exercise. So for the next one, we're going to do what is known as a door cobra. This is going to put the back into extension, really allowing us to stretch and lengthen the core muscles and hit the hip flexors right here in the front part of the leg. So what I'm going to do this time around is face the door frame, put my toes flush against it, take your hands, put them on the hips, and drive your hips and pelvis into the door frame for a stable anchor point. We don't want the pelvis to lift off during this exercise. Instead, what we're going to do is bring our shoulders and shoulder blades backward as much as we can. The more that we go back, the more intense this stretch will get. You'll feel it throughout the whole back, into the core, into the pelvis, and more importantly, into those hip flexors. Hold this one comfortably for 20 to 30 seconds, relax, repeat it up to 5 times. And again, with each repetition, challenge yourself to build into it just a little bit more. The last position, we're going to focus more on one-sided lower back pain. We're going to hit a muscle called the QL or the quadratus lumborum, which is a big overlooked cause of one-sided back pain. Whatever side that you're having pain, let's say it's your left side right here, what you're going to do is put your feet together, put them pretty close to the door frame. You're going to take the hand on the non-painful side, put it on the non-painful side's hip, and then drive the painful hip towards that door. What you want to do is maintain contact on the door, so don't lift off like this. You're going to take the painful side's arm, bend it at 90 degrees, put it overhead just like this. So I'm going to drive my hip into the door and then lean away from it with my upper body. When you do this, you're going to feel a deep stretch pretty much from the bottom of the rib cage going into the lower back into the pelvis and hip. It feels really, really good. I hold this one for 20 to 30 seconds. I just relax and then repeat this one up to 5 times. Even if you don't have pain on the other side, I do recommend doing this on both sides to keep them in balance. With this exercise, we're going to focus on strengthening muscles that support the back to not only get pain relief, but hopefully get rid of it for good. This is a daily strengthening exercise that you can do in bed if your mattress is firm enough, but it will probably be easiest to do on a floor. I call this one the super bridge. It's the bridge, but I'm going to take it to the next level and focus on the full back. So start off lying flat on your back, knees bent, feet flat. I'm going to tighten my core muscles, and what I'm going to do is start with the basic pelvic bridge, and then we'll progress into that full back super bridge. So tighten the core muscles, take your hands, put them right on your hips. You're going to drive your hips upward towards the ceiling until your body is in a nice straight line from your knees to your hips to your shoulders. If you're unable to get into this position, let's say you can only go up an inch or two before you have pain, discomfort, or you just don't have the flexibility, do the best you can. Over time, you should notice that you gain strength and flexibility to get into this position. So what I do is get into this position, tighten my core muscles, and then I'm also going to squeeze my glutes to activate those muscles. You want to hold this one comfortably for 5 seconds. From there, you're just going to relax, take a breather. On the next repetition, try to build into it even more, but you want to do this one for 10 to 15 repetitions. And afterwards, if you feel like you have a little bit more energy, you can throw in another set or two. If you do want to make this one more challenging, lift up one leg like this and put all of your body weight on the other side. I would note though, look downwards and make sure that your hips are in balance. If you're noticing a tilt, really focus on trying to keep the hips straight. And whatever you do on one side, always switch to the other to keep them both in balance. So let's take this one to the next level and now put a little bit more into our middle and upper backs. So I'm going to get back into my basic pelvic bridge position, but this time around, I'm going to lift my arms up like this, bring my elbows down until they're roughly 90 degrees, drive them into the bed or the floor, keep this contact, and then take the back side of my hands downward as much as I can. You'll feel the chest open up and also the shoulder blades in the back start to pinch. What I'm going to do from there is then keep this contact on the floor of the bed and then slowly raise my hands upwards overhead until they're in a clapping position. You should really feel a lot of muscles firing into the chest and the upper back. Hold this position for a second or two and then slowly bring your elbows downward towards your side as much as you can, kind of like creating a W shape with your arms. I'll hit the back just a little bit differently. But I try to do this one nice and slowly for about 10 to 15 repetitions. If you want to even take that one to the next level and really focus on strengthening around the upper back, middle back, and in between the shoulder blades, we can do what is called a shoulder blade liftoff. So what I'm going to do is get back into that basic bridge position. I'm going to take my elbows, bend them at 90 degrees, put them off to my side, and then press downward into the bed or the floor. The goal with this one is to use our arm strength to press down and then lift our upper body upward towards the ceiling. You should almost feel like the chest is being lifted off and also the shoulder blades in the back starting to pinch. In this position, I feel a ton firing, even more so hitting those rhomboids in between the shoulder blades. Those are really good muscles to strengthen to maintain good upper back posture. Try to hold this one for 5 seconds. You're just going to relax, take a breather, and then on the next repetition, challenge yourself to press into it even more. I try to do this one for 10 to 15 complete repetitions. And if you feel like you have a little bit more energy, you can throw in another set or two. If the exercises helped, please support the channel by giving this video a like and maybe subscribing too. If you have any comments or questions, please leave them below. I'll get back to you as soon as I can. Thanks for watching.